Dear learners, I am Mahesh Manike, Assistant Professor, Department of Pharmacology, Anand College of Pharmacy, Latur. Today we will discuss about anti-anxiety drugs. So first of all, what is meant by anxiety? Anxiety is an emotional state, unpleasant in nature, associated with uneasiness, discomfort, and concern or fear about some defined or undefined future threat. Some degree of anxiety is part of normal life. Means anxiety nothing but the tension. Then next point is that anti-anxiety drugs. Means what is mean by anti-anxiety drugs? So these are the drugs which are used in treatment of anxiety are known as anti-anxiety drugs. These are an ill-defined group of drugs, mostly mild CNS depressants, which are aimed to control the symptoms of anxiety, produce a restful state of mind without interfering with normal mental or physical functions. Next, classification of anti-anxiety drugs. So it is classified into 4 classes. First class, benzodiazepines. Examples are diazepam, chlordiazepoxide, oxazepam, lorazepam, alprazolam. Next, second class is that azapirones. Examples are Buspirone, Gepirone, Buspirone. Next, third class is that sedative antihistaminic drug. Example is hydroxyzine. And last, fourth class, that is beta blocker. Example is propranolol. Next, we will discuss about pharmacology of benzodiazepines. So benzodiazepines, chlordiazepoxide and diazepam were introduced in 1960 as anti-anxiety drugs. Benzodiazepines have high therapeutic index. It has practically no action on other body system. Then benzodiazepines do not alter deposition of other drugs by microsomal enzyme induction. Next, benzodiazepines have lower abuse ability, tolerance is mild, psychological and physiological dependence are less marked. A specific benzodiazepine antagonist is available which can be used in poisoning. So look here, the structure of diazepam. So this is a structure of diazepam. So next, mechanism of action of benzodiazepines. So benzodiazepines first of all binds with specific regulatory sites on GABA receptors in the brain. That is, on GABA receptors, that benzodiazepines binds on alpha or gamma subunits of pentameric proteins of GABA receptors. After binding with GABA receptor, there is opening of chloride channels. So by opening chloride channels, there is influx of chloride produced. So due to influx of chloride, enhancement of chloride conductance inside the cell, that may causes hyperpolarization of cell. That is, action potential becomes reduced and hence it produces CNS depressions, post-synaptic inhibition. Look this diagram. So this diagram shows a GABA receptor having a pentameric protein In that, benzodiazepine binds with this site, alpha or gamma subunits. After binding with that benzodiazepines to that receptor, there is opening of chloride channel. By opening of chloride channel, there is influx of chloride inside the cell, and due to influx of chloride inside the cell, it produces CNS depression actions. Look this diagram. This diagram shows pentameric sites of GABA receptors. So this is alpha subunit, beta subunit, alpha, gamma, like this, and that is the binding site. Look here. So this is a binding site for here this benzodiazepine receptors. So benzodiazepines which binds nothing but here, alpha or GABA subunits. So binding site for benzodiazepines. Next, pharmacological actions. So first of all, anxiolytic action. At low doses, benzodiazepines shows anxiolytic action. Second, hypnotic action. At higher doses, benzodiazepine produces hypnotic action, that is artificially sleep produced. Then skeletal muscle relaxant action. Benzodiazepines shows skeletal muscle relaxant action by increasing presynaptic inhibition in the spinal cord. Anticonvulsant effect. Benzodiazepines have anticonvulsant activity. That's why it is used in treatment of epilepsy. Next, peripheral action. In that, neuromuscular blockade. At higher doses, benzodiazepines produce neuromuscular blockade. Then coronary vasodilation. The coronary arteries becomes dilated on IV injection of diazepam. Next, other effects or other actions. Diazepam decreases nocturnal gastric secretion and prevents stress ulcers. Benzodiazepines do not significantly affect bowel movement. Pharmacokinetics. Oral absorption of some benzodiazepines is rapid while others is slow. Plasma protein binding also varies, that is flurazepam shows 10% plasma protein binding and diazepam shows 99% plasma protein binding. Benzodiazepines are widely distributed in body. The more lipid soluble members enter brain rapidly. Benzodiazepines metabolized in liver and excreted through the kidney. Adverse effect. So benzodiazepines are relatively safe drugs. Side effects of hypnotic doses, that is higher doses, it produces dizziness, vertigo, ataxia, amnesia, impairment of psychological skills. Also, hangover is less common in large doses. Weakness, blurring of vision, dry mouth, urinary incontinence are sometimes complained. Some patients experience increase in nightmares and behavioral alteration, especially with nitrazepam. Paradoxical simulation, irritability and sweating occurs in an occasionally patient, especially with flurazepam. Drug interactions. Benzodiazepines with alcohol and other CNS depressant drugs shows synergistic action. Then benzodiazepines with sodium valproate has provoked psychotic symptoms. Next is that benzodiazepines action can be prolonged by CYP3A4 inhibitors like ketoconazole, erythromycin. Cimetidine, isoniazid and oral contraceptives retards benzodiazepine metabolism. Next, uses of benzodiazepines as a hypnotic, as an anxiolytic, as an anticonvulsant, as centrally acting muscle relaxant for pre-anesthetic medication. It is useful in alcohol withdrawal in dependent subjects. It is also useful before ECT, electrical cardioversion of arrhythmia, cardiac catheterization, endoscopies, and many minor procedures. Next drug, that Buspirone, which comes under the category of azapirone. It is the first azapirone, a new class anti-anxiety drug, distinctly different from benzodiazepines. How it differs from benzodiazepines? Look, does not produce significant sedation, does not interact with benzodiazepine receptor, does not produce tolerance, does not suppresses benzodiazepine or barbiturate withdrawal syndromes, has no muscle relaxant or anticonvulsant action. Buspirone relieves mild or moderate generalized anxiety. It has a mild mood elevating action. Then mechanism of action. So mechanism of action of Buspirone is not clear, but by stimulating presynaptic 5-HT1A receptors, it reduces activity of dorsal raphe serotonergic neurons. Buspirone has weak dopamine D2 blocking actions, but no antipsychotic or extrapyramidal effects. Pharmacokinetic side effects and drug interactions. Buspirone is rapidly absorbed, undergo extensive first pass metabolism. Bioavailability becomes less than 5%. When metabolism is active and excretion occurs both in urine and feces, and plasma T-half is 2 to 3.5 hours. Side effects: dizziness, nausea, headache, lightheadedness, rarely excitement. Next drug interaction. Buspirone may cause rise in blood pressure in patients on MAO inhibitors, but does not potentiate CNS depressant. Uses as anxiolytic. Then Buspirone is used as a mild mood elevator. Thank you very much.